Hey everyone, it's Dr. Martin. How is everyone doing today? Coming here from my house. This is my third venue, so we're trying to get this right so it looks right. Hope everyone's having a good Tuesday. So today we're going to be again focusing on mental health. It's Mental Health Awareness Day. We have a guest speaker today that I'll introduce shortly. I did want to go over a few things with the practice just to remind people. So that at the current time, I know we're still all at stay at home, but we are still doing well visits in the office. We've actually extended our hours a little bit with doing those. We were just doing them in the morning. We are now doing them both in the afternoon as well as the morning. Again, when we're doing well visits in the office, we're only doing well visits. Sick visits are all outside. We are definitely still using universal precautions in the office. We use gloves and masks, and we've gotten a lot more serious about that, and we'll continue to be. And I don't see any end in sight for us doing that, so that will continue as well. In terms of sick visits, we are still seeing those in the parking lot if they are respiratory or fever or could be related to COVID-19. On the flip side, if it's something like injury, something very clearly not related, that wouldn't be related to COVID-19, we do see those in the office. But for anything that could have any potential to be related to COVID-19, we are doing that outside in full protective gear. We're definitely starting plans to think about what happens, which very well may, as this extends into cooler weather, if there's further outbreaks and things of that nature, how we manage that in the office and separating spaces. So we'll keep you updated about that as well. Since we're doing an interview, we use a little bit of different platform. So what you will see at the bottom there is a link that you have to give permission to Facebook to share your information from Facebook to allow you to actually put in comments or questions to us as the hosts. So if you do want to do that, you can do that. You have to accept that. If you want to just put comments on our Facebook, that's welcome as well. Those will be answered later. I definitely will be looking at those. We may even incorporate them into later Tuesday broadcasts as well. So on that note, 2 weeks ago, for those of you who attended, we had an interview with Dr. Segura. It was our maiden voyage. I won't say the ship sunk, but it definitely had some water in it. So I think we have fine-tuned some of those problems that we were experiencing with feedback and sound. So I'm hopeful that things will go a lot better today, and I'm so sorry, Dr. Segura, that was how it went. It was as much my fault as anyone's. So we will do better today, and so I thought this was an opportunity for a second try and see if we could actually hear all the really good information that she has. And I realized last time I didn't introduce Dr. Segura for those who don't know her, so I thought let's be a little more professional this time, and I will do that as well. So for those of you who don't know her, she graduated from the University of Notre Dame, actually did medical school at GW University, and then did her pediatric training at Children's National. So you'll notice a lot of those were local, and so she's a local person. And then she decided to move. But only temporarily, where she worked at the Children's Hospital of Philadelphia for a couple years in their outpatient clinic there. So one of the fun things of having your practice is you get to interview and pick the people you work with. So I had that opportunity, and calling references is always an enlightening experience. You never know what people are going to say. But I can tell you, and I've had this actually with all my providers, it's amazing when you call someone and you just immediately know how they feel about the person. They're of course professional about it. So I won't say her prior boss was crying, but she was definitely not happy that Dr. Segura left her. And that morning came over on my reference check when I was speaking with her, and she was lovely. And so happy ending. She's been with us now for a while now. I think it's been 2 years, I think we're going on. So welcome, Dr. Segura. Let me see if I can do this right. We're going to get her up so you can actually see her. So again, we're gonna, hey, Dr. Segura.
Thank you.
So today, yeah, we're gonna talk about mental health. I know you're running into things as well. I wanted to, I guess I'll start with a little bit of a story I had. And I was biking out with my family and ran into another family that I know. And we got to talking about kids, particularly in the school age, elementary, and this one happened to be early junior high, and how they're dealing with the situation right now with COVID-19, with us being home and isolated, and how difficult that is. I sometimes wouldn't know it with my own kids because they're just happy not to going to school. But your kids are experiencing it in different ways. And so one of the things I have gotten a lot of questions about, and this conversation led to when I was bike riding with my family and just happened to run into this family, is separation from parents, where kids are either doing things like co-sleeping because they want to be near the parent, or they don't want the parent to leave, or they're worried where the parent's going. And what do you tell parents? Like, how do you manage that? Like, what can parents do to alleviate some of the anxieties of kids during those situations? So I'd love to hear your approach. I think people heard a little bit of mine, but I would love to hear how you approach that with families.
Absolutely. So the first thing that I usually tell parents during this very interesting time of a global pandemic is talking to your kids during the day. Sometimes we think it's easier maybe not to address what's going on because we're going to cause more fear and more anxiety in our kids. But you know, the elephant's in the room. Their schedules are totally changed. They're not their friends. They're seeing their parents work from home. And so they know that things are very different. They're picking things up from the news. So the best thing that we can do is actually talk to them and ask how they're doing and initiate these conversations, and not pushing it, opening the conversation for your kids and seeing what questions they have. I think sometimes as parents, we tend to just jump in and just tell them everything we know. And sometimes we're telling them way more than they want to know or they should even know. So really having them kind of direct the conversation, and then making sure that it's not just like a one-time deal. It's kind of like, okay, I had the combo and we're done. It's in multiple times.
Yeah, I guess that's a question I get, and it's not just, it's relevant to a number of conversations, not just this anxiety conversation, but even talking to teens about sexuality and those types of things. We're not talking about that today. I'm not surprising you with that topic today. But how do you know how far to take that conversation? Like, because I think that's hard sometimes to know. It's like, how much information is too much? And you've got kids at different ages. So how do you approach that? Like, how do you know when it's like, oh, that was enough?
Absolutely. So having them direct the conversation and kind of seeing where they want to go, because one day they might just have questions about like, why am I not going to school? And another day they might have want to know about like what exactly is going on, like what is this virus called the corona that people are talking about. So kind of letting them sort of drive what they want to know about. And then really just kind of like, I think this is probably a good time to just talk a little bit about the different age groups. So for young children, and that's like, preschool, kindergarten, these kids, they really want things simple and concrete. So when we're reassuring them, we're telling them, adults are here to keep you safe, and let's make sure that we can do what we can to keep the germs away. And let's sing the happy birthday song when we wash our hands. Middle childhood, this is the age group that's a little more challenging because they have a lot of difficulty between distinguishing fact versus myth versus fact. So if they hear on the news, X number of people are dying from coronavirus, they are going to think, I'm going to be one of those people. So really clarifying. And then the high school students, those are a little easier in some ways in that they're more direct and open. So because their cognitive development is a lot more advanced. And what's important in this age group is sort of directing them to reputable resources like the CDC. I mean, they are way more internet savvy than probably we are. They know how to use Google very well. And they use all these types of social medias like TikTok and Instagram and all this kind of thing. So really that's a great point that you made, sort of kind of distinguishing between what age group our child is in and sort of how to direct that conversation.
Yeah, no, that's great. I mean, I think it's actually consistent with a lot of other conversations you have with them too, right? It applies. How do you? So I've had multiple now with families and the kids that are between that don't normally co-sleep, but all of a sudden want to be in bed with mom and dad, say the 5th grade to 7th grade range. How do you discourage families from doing that? Do you indicate not to let the child co-sleep? So when they show those kind of what we call regressive behaviors, right, where they start doing things that they haven't done since they were toddlers, what do you do with the actual behavior? Do you just address the feelings, or do you actually not let them?
Yeah, so I usually recommend families to address what's going on. Like we talked about a lot about it. It really starts with talking during the day, making sure that they feel reassured and feel heard. A lot of times that happens because they're scared. So really providing that reassurance that adults are here to keep you safe. And this is why we're not at school right now, because our home is our safe space. And then I really try to really discourage co-sleeping. We want to keep structure as much as possible. And this really goes into, as a family talking about the next day or the next week and making sure that we're waking up at the same time and we're going to sleep at the same time, at least during the week. And maybe we're not in our PJs all day long, and really trying to make the day as normal as possible. And so that usually kind of gives them a little bit more of a sense of normalcy. It's a slippery slope once you start co-sleeping, because it's going to be really hard to kind of get them back to sort of what the regular routine was.
Yeah. No, I was curious to see what because I've been talking to other physicians too. I see people take different approaches to it, but I almost look at it. It's not quite as severe, but like my school avoidance kids, like once they stop not going to school and you let the anxiety overwhelm them and keep them from doing the thing they're anxious about, then it sort of steamrolls, and it's much harder to get them back to school than it is if you don't let them not do that. So I think I agree with you. I think that it applies to try to really not let them give in to the anxiety and hide from the thing that they're anxious about, but do it in a gentle way. I think that that makes total sense. The other thing that and so I just told Dr. Segura recently. I just had a meeting in July that's been canceled, and I can't tell you, I've lost count of how many meetings I'm supposed to have that have been canceled at this point. And now my next meeting is like in August, and I'm sure that's going to be canceled too. But this is happening to kids and families as well. And so kids have camps, they have, summer plans, and I have to be honest. I mean, you and I are sort of in the trenches and hearing and talking, and I'm not sure things are looking great for our summer. And so a lot of those plans probably aren't going to occur, and kids are starting to get anxious about that, and families. And so, what do you tell kids? Like, how do you deal with them? Because that's going to be very upsetting and disappointing to them. And how do you manage those feelings?
Absolutely. I think even parents, as parents, we're all disappointed because we have so many things that we had lined up for the next couple of months that are kind of unraveling. But, it's important to be as reassuring as we can, but not making false promises. So I think some of the things I started seeing a little bit with parents in the beginning was, well, we're going to go back to school this year. And, we know that that's not going to happen. Maryland, Virginia, DC, and probably 95% of school districts around the country are closed. And we don't know what school is going to be like in September. It probably is going to be the school that we knew pre-COVID. So providing reassurance that, the adults are here to keep you safe. And, this is just, we don't know when things are going to go back to what we used to know life like. But the reason we are doing this is for your safety, and we are going and trying to be creative during the next couple of finding things that they could look forward to. But it's tough, and I don't think any of us really have the correct answers, because I think we're also dealing with our own disappointment. But I think the most important thing is just not making false promises, because we don't know ourselves when things are going to go back to normal.
And I guess I'm going to open it up a little bit to you and just say, like, what do you have general advice for families, particularly for the older kids, of how to manage screen time? Because that's a question I keep getting asked about. I know it's not exactly anxiety related, but I do think a lot of behaviors stem from the screen time, and you can extend it to the lower age too. But like, do you have advice? Like, how do they manage that in this time?
Yeah, I mean, so the rules have changed, right? And I think I think that we know American Academy of Pediatrics has even mentioned that you know, we're living in a very interesting time. So now, but I think as a family trying to plan day, especially now that there is some online learning, we know that kids really have about an hour of attention span. So maybe making a plan that they do a lesson at 9 and then go outside afterwards and take a break and come in, maybe do another lesson, then lunch, and maybe they get screen time afterwards. And that is also a little bit of a time that mom and dad can work on some other things that they need to, because also parents are also working from home. So yes, we understand that screen time is going to increase, but sort of, I think planning the day and planning the week with your kids sort of sets some goals, and having kids, ask kids in the beginning of the day, like, what do you want to accomplish? Whether that's talking to a friend through Zoom or, FaceTime, or, lesson done, or even going outside, little things give kids a huge sense of accomplishment, and it helps their self-esteem.
Yeah, I love that. I mean, that's, to me, like, my biggest advice is schedules. It's like, it's when you have all this uncertainty, giving kids a sense of control, and that you have a schedule and you have a thing that you can depend on, right? And they may even have some say in that and have some control, like giving kids back control. But it is tough because it's like you have to live in the moment, because you don't know what next week's going to look like. And you have to be really careful about what you can promise them, because we don't know. And I think that's been, with the older kids particularly, it's like, that's hard. You can't hide the truth from them. They're seeing the media, and they probably know more than we do sometimes when they're finding it on the media. So, well, I want to thank you, Dr. Segura, for taking time on your day off and away from your little daughter. So it was awesome, and I think we did better this time. I think mission accomplished. But I will let you go on with your day, and thank you so much.
We're good. Thank you.
Right. Talk to you in the office.
Thank you. All right, bye. Thank you.
All right, guys. So you hear it from Dr. Segura. Hopefully some of that sounded similar to some of the things I said. I certainly will put some links and information up on our Facebook. There's a lot of organizations that have stuff up now. I will remind people that we do provide guidance and counseling on this stuff. And so please reach out to us. We're here. While we're not psychiatrists, we definitely do a lot of mental health care in our office. And if we don't have the answers, we will find someone to help you. Right now, at least, this is one good thing about telehealth. You can definitely find therapists and psychiatrists who are out there and willing to see patients. I know there was on the Facebook comments before, there was, one of the frustrations, and I think it was more of a general comment about cost of mental health and how insurance doesn't cover it in a lot of circumstances. And I 100% agree with you, and we are working really hard. So many of you know I'm in leadership at the Academy of Pediatrics in Virginia. We have something called the Virginia Mental Health Access Program. Unfortunately, it's operational in Northern Virginia. It's not operational in all sections, but that means it's available for you all and for us to access. And so there's often, if cost is prohibitive, it doesn't need to be. There are definitely organizations and places we can get you into that VMAP will help us, that have sliding scales, that have free services. It shouldn't be a barrier. And so again, just reach out to us. We can help navigate, because I know the navigating is not easy, but I will say that the VMAP program has really done a lot to break down some of those barriers for families and provide, basically they'll follow you through until you're connected with someone. And that's huge. On that note, I wish I had great news with COVID. I do want to kind of give you a little bit of update and our take on things. At this point, we still don't have enough testing in the state, but there is a task force that's working very hard on doing that, and I'm hopeful in the next 2-3 weeks. We're already seeing it ramp up, but it's going to take a few weeks to get probably where it needs to, and that's an optimistic look at that. I would, again, caution people about using blood tests or serology tests that look at antibodies for COVID-19. A positive test doesn't necessarily, one, mean that you've had it. There are things that will cross-react with those types of tests, so it may not be accurate. And two, it doesn't mean you're protected. That's the biggest danger, is that you go out, it's like, well, I've had it and I tested positive and I don't need to take the precautions. And the reality is we don't know that, and there's really some case reports and instances out there that we're concerned that that isn't the case, actually, that people are getting either reinfected or maybe reactivated. We're not sure yet. So if you're being offered those kinds of tests, unless it's for academic purposes or tracking purposes, it's probably not going to help you and your family. So I would advise you to kind of avoid that at this point, as the NIH and other places are actually looking at the utility of those. On that note, I want to wish, from all of us at Einstein, I want to wish you and your families well. We're here if you need us. Right now, we're still doing 7 a.m. to 3 p.m. hours. I'm thinking we're going to be changing soon and extending a little bit again, but we'll keep you up to date as that happens. It's always a moving picture. And also, again, I will say, send us your comments on Facebook about this or any of the other live streams that we've done. Any questions about some of the things that we discussed today. I will be putting resources up there as well for you to be able to access. And on that note, I wish you all good mental health. And until next week, we'll see you again. Take care, everyone.